use an EKG machine, how to place limb leads on a patient, and as well how to get the result from the EKG. The first thing above all that you would like to be doing before you even start on it would be to do your hand wash properly, dress properly in the correct PPE. In this case, for this kind of procedure, the only PPE that you would have to require to have would just be the use of gloves and making sure you wash your hands before and after the procedure. For the video, I will be using hand sanitizer as I already did my hand washing prior, and then of course applying the gloves afterwards. Okay. So for this type of procedure, EKG, you could place your patient in one of two positions. If they are most comfortable with, the most regular one that you place them in would be a supine position, which is straight, having them lay down with their body length straight. There will be other occasions where your patient might have trouble breathing or any other respiratory problems. In that case, you are allowed to use the semi-Fowlers, which is just leaning them a little bit more forward for the procedure. For this procedure, I'm going to be doing semi-Fowlers while I'm doing the placement so that your camera is able to get a better angle. The secondary thing that you will have to do, of course, is expose what's the chest area and the leg/feet area of the patient. So you expose the area and just put these a little bit more upwards. Okay, so before anything, of course, some patients, you might have a female, male, depending on who you're doing this procedure on. In my case, I'm doing it on a male patient. There will be times where your patient will have chest hair, facial hair, and any part of their body hair as well. So when it comes to those cases, you will use a disposable razor that you will be able to use to just shave off the area that you will be using, whether it be the chest area or your arms or the legs. In this case, you would just use the chest area and just shave off the necessary body hair that's needed. Just shave it off and wipe it down. And then also, in order to get a little bit more thorough and cleaning the skin, because some skin does leave either dry skin or some dead skin residue on it, just grab what is a little cleaning wipe and just wipe on that area, just rub. It might turn a little pinkish, but that's perfectly fine because you're just getting rid of that dead skin that could be lying there. After that, of course, your first step of placing your limb leads would be position your primary limb leads, which are on the arms and on the ankles or leg area. So the first thing that you have to place is your limb leads, and that will be these 4 limb leads right here. They will each be titled. Each one will have their own title, whether it be indicating right leg, left arm, left leg. So in order to find exactly where those placements need to be placed at, we're going to focus on the arms. Now, you're going to have to focus from what is the shoulder to the wrist. Of course, you're going to try to avoid hitting any bony areas like your elbows, or even putting it in a position where there's too much muscle that could kind of interfere with the EKG results when it's reading the leads. So for this area, for this arm procedure, for this area, it would be more prominent to apply them more on this area right here, where it's not down to the elbow, but it's not high up on the muscle part. Same thing, you're gonna copy and paste from the same area you put it here, you will replicate it and put it on the other side. So of course, you'll grab your EKG, your little strips that you will be using. In this case, you will be using a total of 10 just for this procedure alone. So to place these 2, you just grab them place them. And they're gonna be quite sticky as well. And from there, you're just gonna place them and put them on the area that you will specify on, which is right here. And same thing as I said, whatever you do on this side, of course, you're gonna have to copy and paste and do it on the other side. So let me just place that there as well. And of course, if you see that your patient is kind of uneasy, you could just talk them through, let them know what you're doing, and just secure them and have them feel more relaxed. It'll be better if they feel more relaxed because the procedure will run through much more smoothly. After that, you're gonna head down to the legs, and for these limb leads, you're gonna focus on what's starting from the hip to the ankles. Of course, like same thing on top, you don't want to hit that much muscle up here, nor do you want to hit your knees to where there's a pony prominent, and avoid as well the ankles. So for this procedure, we're gonna hit more towards the upper ankles. We're gonna put them up here, little place above the ankles. Same thing, whatever you do here, you will copy and paste and put it here. So getting those limits ready. You just take 2 more and just make sure to place them on the equal here and here. Now that you have your primary place leads, you could of course now attach what is, like I was saying, each one will indicate where you have them, and if your cord does run short, you will have to move it upwards. Of course, these will be placed more towards the ending of your procedure, just so that you're able to not only attach these but attach the other chest limb placements, which we're going to be doing next. So heading on to your chest limb placements, you will have to try to find the V1 and V2. V1 and V2 are similar because they will be right next to each other, just that one is more on the right side and the other one's on the left side. In order to find V1 and V2, there's one way that could help you finding it, which is finding the end of the clavicle area, and there's going to be a hollow spot down. If you press down on that patient's clavicle area, that will indicate your first intercostal space. From there, you will head down until you reach your second rib, second intercostal space, third rib, third intercostal space, fourth rib, and then your fourth intercostal space. That area right here is where you will place your V1 and V2, which will be your next chest limb place leads. So you will place both stickers on each edge, making sure that the V1 is always to the right, V2 is on the left. So you have those. Place V1 on the right side, and then V2 would follow it on the second side, right here, on the fourth intercostal space. Now, to make it a little bit more easier to find the rest of them, we will skip V3 and head down to V4. Another way to find V4 is just indicating the start and the end of your clavicle and just going in through the middle, meeting in the middle, and just lining it downwards. And right here you will find the fifth intercostal space, which will be the place lead for your V4. So it will be some down where the chest area is, leaning more down here, and you will find that hollow area down there. And then same thing, we're gonna skip V5 and hop onto the last one, which is V6, which will be primarily used patient's axillary point. You'll find the axillary because it's down on your axils. So your axillary, you're going to go down a perimeter and you're going to go down. That's one easy way to find it. Just indicate the axillary, which is this area right here of the patient. Of course, I'm going to place the limb lead on this side just for the reference for the video. You're going to be placing it here, go find it in the middle, and then just go perpendicular down. And you will find on this area is where going to be your V6. Of course, it's going to be perpendicular to your V4. So, of course, it's going to be perpendicular, so it's going to be right on this area right here. I will be placing it on this area right here. Same thing, I'm going to place it on this side. So we found V6, axillary, head down perpendicular, and place it. From there, in order to find V3 and V5, it's just meeting in the middle of each of the limb placements and just sticking it on there. So V3 meeting in the middle would be down here, and V5 would be the same. Once you have V1, 2, 3, 4, 5, and 6, and your primary limb leads on the arms, you will have the patient, of course, uncross from uncrossing their arms or their legs so that it doesn't affect the EKG machine's reading. From there, you will grab your limb leads. You will grab the cords and you will put them properly with the indication of each one. So just let me do that and we'll head to the machine. After that's done, you go ahead with your chest placements, which is just placing them. These will each indicate as well the V, and apart from that, they will indicate their number running from 1 through 6. So V1, V2, and of course just talk through the patient, making sure that they are still doing okay. V3, V4, V5, and finally V6. Once you have everything placed from V1, V6, and all your primary limb leads, you're going to, of course, turn on your EKG machine. You will enter the patient's information, whether it be their date of birth, their age. Each EKG machine works differently. Of course, make sure that it has paper in there and that it's filled with it. Okay. After doing that, of course, you will enter the patient's data, date of birth, patient ID, first and last name, whatever it indicates to you on the machine. from there, you will make sure that all the limb leads are being read. And then from there, you just hit start. Hit it, and it will start reading it on the machine. And then from there, we'll just begin. Until you reach a certain point where it stops. And then that is how you do an EKG procedure and how to get the leads read. After that, of course, the doctor will need it to go over it, see how the outcome of the patient is. And from there, you tell your patient you finished it. We are done with the procedure. Now I'm going to go in reverse and take off the leads. And then from there, if the patient wants to, they could take them off themselves, or if not, you as the MA could take them off for them. Okay? And make sure to dispose of any trash you get on the way. So of course, powering off the machine, powering it off, and then detaching the limbs. Attaching each of one of the strips. I'll place them here in the meantime. Now from there, just making sure to take each one from the patient carefully. It might pull on some of their skin, which is why in the beginning I mentioned that it's best to just shave off the area so it hurts a little less and it's not pulling on any of their hairs. Being as careful as you can with the patient. Most patients will do it on their own, which is also good because it gives you an advantage to give a head start and give the report to the doctor and get your station cleaned up with. Once you did that, of course, dispose of that. Have the patient cover up if they need it. I know some clinics will be cold, so they could cover up when needed. And then from there, the patient will leave the room. Of course, from there you would head down to grabbing your disinfecting wipes, whatever wipes you have in your clinic, and just getting them out and carefully wiping down the machine that you used, as well as wiping down each of the limb leads. You can grab another one if you need it. Once you have all that cleaned up, you will just roll them up as needed. And then of course put your machine away. And then of course getting rid of your gloves into a trash can. And then going to wash your hands, and of course doing hand sanitizer. And then just performing your hand washing routine, making sure you get your hands cleaned after working with a patient. And that is how you use an EKG machine and putting the limb leads to working the machine to get the lead results.